But before I start with an overview of the navtemadlin trials, you know, the title of this webinar is also BOREAS. So I thought maybe we should all just make a small interactive question. What is BOREAS? What do you think? For what stands BOREAS? Next slide, please. I would like to show you the question. Is it an acronym for Beyond Ruxolitinib Early and Active Salvage Therapy? Or is it part of the name of an energy supplier to symbolize the power of MDM2 inhibition? And believe me, this is not a joke. There is an energy supplier who has BOREAS in its name. Or is BOREAS a strong Greek god of the north wind with a very violent temperature match? So I'm really very proud of myself because, you know, answer number one, which was now answered by 2/3 of the attendees, was something I thought a long time. How could I use the BOREAS letters to make, this is an imagination, this is something I just imagined. And actually BOREAS stands for blocking MDM2 to reactivate P53 in myelofibrosis, just by the way. But indeed, BOREAS is the name of a Greek god of the north wind, who is very strong and very violent and has a temper that is very active. And this is actually as a symbol to symbolize a new treatment era in patients with MF. So just as an answer to what is BOREAS. Next slide, please. So BOREAS has two parts. We have the phase 2 trial. This is the KRT232101 trial. This was, as I said, phase 2 and an open label trial for patients with either primary or secondary myelofibrosis who were refractory and or relapsed to JAK inhibition. Mind you, this is very important when we look at the data to remember that in this trial, no patients who were intolerant to ruxolitinib were allowed to be included. This means the data in the trial was only for patients who were refractory or relapsed to JAK inhibitor therapy. Next slide, please. And as I said, in this trial, primary or secondary myelofibrosis after failure of ruxolitinib, patients have to be wild type for TP53, no mutated TP53, and patients had to be intermediate or high risk DIPS score. Patients were then randomly assigned to 4 groups, to 4 cohorts actually, with different treatment regimens and durations. I will come to that soon. The primary endpoint of the trial was spleen response from baseline to week 24, and spleen response was defined as at least a 35% reduction in Mills volume by MRI by week 24. One of the key secondary endpoints was the improvement of at least 50% of the total symptom score at week 24 compared to baseline. Next slide, please. And then this was immediately attached with the phase 3 trial, which is now recruiting and active. This is a global phase 3, as I said, trial, randomizing patients again with primary or secondary myelofibrosis after failure of ruxolitinib. Again, I stress the point failure and not intolerant to ruxolitinib, to be treated in this trial. Next slide, please. Again, the myelofibrosis refractory or relapsed patients had to have TP53 wild type, refractory resistant to treatment, and the randomization was done 2-to-1, 2 in arm 1 to 1 in arm 2. Arm 1 was treatment with navtemadlin, 240 milligrams, 7 days, that means 1 week, then 3 weeks off in a whole 28 days cycle. Again, primary endpoint was spleen response, again at week 24, again at least 35% reduction of spleen volume by MRI. And another, again, key secondary endpoint was at least a 50% reduction in total symptom score, again at week 24. Next slide, please. The main inclusion criteria of the BOREAS phase 3 trial, I will not read them, but I just want to stress the difference to other trials, because, you know, the definition of refractory or relapsed is, you know, is quite arbitrary and sometimes very difficult, and we don't have really strict criteria sometimes. But in this trial, really, relapsed or refractory have stringent criteria that are really quite hard, so that we could really, when we get the results, hopefully say something to patients who are clinically relevantly resistant or refractory to prior JAK inhibition therapy. Next slide, please. And with this, I actually will conclude the second part, just showing that, as I said, the phase 3 BOREAS trial is actively recruiting all around the world, with many countries participating in this trial.